create that member with. And if the service does require a prior auth and all of the data elements have been correctly entered in the visit import, please submit a ticket to our provider EDI integrations team so that they can further investigate. All right, so let's talk through the auto placement by service code workflow. So I know I spoke to it a little bit earlier, but just to give you the definition, so the auto placement by service code feature will allow providers to service members for services that do not require a prior authorization. So when this feature is enabled, the allow auto placement checkbox field on a service code will show and it'll have that box selected. So that's one way that you can validate whether the service requires a prior authorization or not. So to walk through the process for our HHA providers, if you've never serviced the member before, so you do not have a record or profile within your HHA Exchange portal, the first step is to create the member record or profile through or in your HHA Exchange portal. And one of those things to call out is the member Medicaid number must be added for the successful placement for this to work properly, right? What we're doing is when you add the new member and create it in the profile, you will then, step 2 is to add the payer contract. One of the fields that is validated to ensure that the member is identical is that Medicaid number. So if the Medicaid number matches, that will create, after you add the payer contract, that'll automatically link that member profile with you, and then you'll be able to start recording services, right? Clocking in and out using EVV for that member with the new record or profile that you've created. For EDI providers, the visit record is sent to us right through the API or the visit import. The member's Medicaid number is present, and then we indicated again that office NPI is very important to be included, right? We need to be sure that we place them with the correct office. And then also payer ID must be entered for the successful placement. Once that imports successfully for EDI providers, the member profile is created automatically, and so is the placement. So pretty much for EDI providers, everything remains the same, except office MPI is now required. Technical customer care. All right, for technical customer care, we've made a lot of, I will say, recent improvements. We've heard a lot of just communication and discussion, right, with from providers in Minnesota, along with others, that there just needed to be some improvement, that we weren't meeting those expectations, right, with support. So what we've done to better serve, right, like our clients, we have refocused technical customer care, and the two things we've done, we have added new leadership. So we've put new leadership in place who have already improved a lot of the processes that we have internally, whether that be with quickly addressing tickets, making sure that they get to the right teams. So there's been a lot of new focus on that. And then we've also opened up a technical customer care center in Bloomington, Minnesota, which I believe can sit up to, it's somewhere around 60 additional seats. So we've added just more support, and it actually happens to be in Minnesota, which is awesome. So we've been able to just increase, right, our level of support tremendously. We've also put in place new quality assurance procedures just to review effectiveness of tickets, right? Making sure that we are responsive in a timely fashion, making sure that tickets are being resolved in a timely manner, and then also making sure that communication is continuous and, just improving that overall. And then, as I quickly addressed before, we have improved functionality and just processes to ensure that tickets are being resolved quicker and that your expectations are being met and that you understand, right, where your ticket's at, what's kind of happening and agree with the resolution of the tickets. All right. So to utilize our client support portal successfully, I will go through a live demo, but I wanted to go through some of these and share these with you. So the best way to receive technical assistance is to submit tickets through our client support portal. So one of the things I see a lot of providers do is, or just in general, is there's a lot of details being included, but we don't include everything. So on that initial reach out, when you are submitting a ticket, all I ask is submit as much detail as possible. Include, anything, even if you feel that it's overkill, please, please include it, right? The more, the better. Then we can have all of the information. And what that does is it really streamlines just like that ticket process. We don't have to go back and forth, right, to make sure that we have the correct data. If you give us everything up front, we should be able to do our review, provide feedback, and keep that, continuous communication going back and forth. And these are two screenshots, so we'll jump into it in a little, but this is on the left, you'll see the client support portal. That's just a screenshot of the different portals that are available today. And then I clicked into the general support one, which I believe is called technical customer care now. And it just shows you how a ticket will look when you're entering it and what fields are kind of required. And then reviewing technical customer care tickets. So within the client support portal, you have more than the ability, I should say, than just to add or submit new tickets and communicate back and forth, right? You can review old tickets. You can see the resolution on them. And I've indicated that in the top one over on the right. It says request. I know it's kind of small, but you can, once you click on the requests up in the top right, it'll take you to the page that looks similar to the second screenshot below. And you can then filter tickets and find tickets, whether they were created by you, if you were tagged on one, any open or closed tickets, and just adjust your filter settings to find the ticket that you've previously submitted. And this is really helpful just to find past tickets that, maybe there wasn't a resolution or you can't find the previous communication and need to go back to it. This would be a very helpful way to find, all of your tickets that you've submitted in the past. All right. And then some of our common technical customer care tickets that have been submitted. I pulled a lot of the recent tickets just from Minnesota providers, and these were the top 5 most common tickets. So I just wanted to list them here and share them with you. We have some job aids at the end that will help with, some of these, but just to list them: missing member and or authorization, my account is locked, password reset, general mobile app questions, and then a lot of just questions and inquiries about call dashboard, call maintenance, clocking in and out, and linking calls. And here are some of the helpful links that I mentioned earlier. We will add some more here. So when this is shared, you'll have quick access to the auto placement by service code, client support portal, and then our provider info center page. All right. So I will stop sharing really quickly. And what I will do is I will jump into the client support portal and just walk through that with you live. All right. Okay, so I have this bookmarked, but really I just leave it here. If I hit client support portal, it'll take you to this page. You can search for any helpful resources. If you just want to type in EDI, it can help you get to the ticket that you may need. So if you have general words that you want to utilize or add or include right in your ticket when you're submitting it, please feel free to type them in up here if you're unsure of which portal needs to be submitted. And then it can help you. You could say, oh, I do have, import rejections. Okay, I'll go ahead and click on that, and that'll take you to the ticket where the fields are required for when you're submitting the ticket. So I'll jump back really quickly, similar as I did before. Here, I will delete this really quickly. I clicked on search for helpful resources, typed in a general, and it was able to, if I need help with billing or admin, but it pulls up all helpful request forms or portal types that could be submitted with based on the keyword that I've entered above. But if you're ever unsure of where to submit it, what I would say is it's always safe to lean on technical customer care. So what you do is you would select this portal. You can select, hey, I use the free version. I have, I have a general and need assistance, general questions about the mobile app. Click on that, and then what it'll do is it'll pull up all the questions or required fields based on the category or topic that you've selected. So you could just say mobile app questions. What does the caregiver need help with? You could say clocking in and out, right? And it automatically pulls it up. There's a drop down over here. What's your name? What's your username? And just ask you a bunch of, again, different fields that are required to help us get all the information that would be necessary to help get this resolved and answer all of your questions. Drop down, you can type in Minnesota, and then you can also include the payer and you can share with someone if wanted. And then once you hit send, then what it'll do is it'll create a ticket number that you can then go and review. All right. So we'll jump back out. What I'll also cover over here, which I think is helpful, is just reviewing. So as I said earlier, up in the top right-hand corner, we have requests. You'll click on that. You can go directly to the ones created by you or go to general or all. I think we're good here just because they're general. So they have different statuses and types. I could then go ahead and filter for the ones that I want, right? Closed. If they have a specific word, I can use EDI again. And if I wanted to also filter out who it was created by, or if maybe I was the participant, but I can select, I only want to see the ones created by me that are now closed. And you can, if you know that you emailed or called in, you could add that, but I generally like to leave that open. But here are all the different tickets that are specific to the keywords that I've selected and the filters that I've applied. All right. And then I think we wanted to go through just one final thing on here. I did reference it during the call. I'm going to zoom in really quickly. But we created a job aid specific for the auto placement by service code functionality. So for the services that do not require a prior authorization, so no prior auth, this is what the workflow or job aid that can assist you right with that process and how to go through that. So as I stated earlier in the presentation, right, the first step in it is verifying whether that service or service code, I'll say, is allowed in the auto placement process. So what you would do is you would go to admin reference table right here, reference table management, and go to the contract service code. And what you're looking for is in this screenshot right here, there's allow auto placement. If this is selected, that service code is allowed right where that functionality will be applied. So you can do the auto placement by service code functionality. So you can add the member and then add the placement. If it is not selected, right, that would mean that that service then requires a prior auth. And if all of the information should be in there, that's when you would go to the client support portal, which we just reviewed, and submit a ticket and let our support team work through that and look through that missing authorization. I know it says right here, payer eligible service codes. I'll just quickly skip down to it. So we included on this one that was specific to Minnesota for the payers in the state right here, payer eligible service codes, we actually added them to the bottom of the guide. So all of these service codes that are listed here for the different payers are the ones that do not require a prior authorization. So they would apply to the auto placement by service code functionality and process. And I'll just scroll through them, right? We have Health Partners, Hennepin, and just to name a few, just wanted to let everyone know. So it's kind of like a one-stop shop for everyone. You can just reference the service codes down at the bottom. And if you do see that service code listed, you can then work through the process and take action by reviewing and working through the process on this job aid. So what you would do is you would navigate to member, member search, locate the member. If that member does not exist, you would click member, new member, and then create that member's profile. Once that member's profile is successful and you've created it and you've added the Medicaid number, right? It is a must. You would then select contracts. So it'll be on the left-hand side. And then you will click the add button, which I believe is all the way on the right. So it's actually highlighted right here. So contracts is right here on the left. And then once you're on the contracts tab or page, you'll go over here on the right and click add. You'll then get a pop-up menu or contracts window that pops up. It'll have you add the contract that this applies to, the service start date, the service code. And then once you have validated that all of this information is correct, you would click save to finalize it. What that will do is that will start the auto placement process. What it's doing is it's validating the information for the member that you've added and service code against what is already in the system in the back end, right? It's trying to find the member like a one-for-one match. When it does find it, that will be indicated by a populated alternate patient ID. So there is an alternate member ID, you may also see it, or alternate patient ID. It'll be listed right here. When that has a number that is listed right here, that lets you know that that was successful. So that's what's kind of stating right here. A populated alternate patient ID indicates a successful auto placement. And then really just for EDI providers to go over it one more time, the process remains the same, except Office NPI is now required. So you already provide us the Medicaid ID or Medicaid number, Office NPI is required, and then payer ID is always a must. So those are the three real drivers. And then again, listed the service codes that are in scope down below. All right, so that was everything that we had for today to cover on the presentation. I will quickly check just the QA box to see if we have any, open questions that I can address.
I can help read some out for you here, Kyle, so we can
Perfect.
have to try and juggle both. The first one that I'm seeing, can you talk about what happens for somebody who receives services that both require prior authorization and then don't require prior authorization? So let's say a single provider is providing support to one person, and they're getting one service that requires an auth, one service that doesn't. How should they proceed through that process?
Well, so they have two different, sorry, I apologize if I missed it, but is it two different people or is it the same person?
Same person, yep.
Cool, perfect, thank you. Thank you for clarifying. So really what we're trying to do, right, is create the placement with them so that they have access to the member. So if the one with prior auth comes in, what they'll have to do is they'll have to add a second placement for the one that does not require a prior authorization, but they already will be able to view, right, the member because there should be an authorization for the services that do require a prior auth. So that member, they should already be able to find them, right? So they should be able to go to search, find the member, and then just ensure that there's an active placement. So they would basically go through on the job aid. I think it's like they don't have to create the member, right? They just need to go through adding a placement for that specific service. that does not require prior auth.
Great, thank you.
You're welcome.
Then what about, we have a question that says they're using a third-party vendor, and their visits are rejecting, it sounds like, because there is no, looks like, member or staff being in the HHA portal. How should they proceed?
Okay, I would definitely recommend reaching out to our EDI team. They can, provide them as much information as possible. I would be willing to bet that it is, they'd be able to give pretty quick guidance, but I'm a very visual and hands-on person. So I think just step one is creating a ticket with our support team or our EDI team and allowing them to review the issue.
Perfect. And then following up on that, there's another question about when a provider goes to do a member search in their portal and they're not finding anybody. What's their next step?
Yeah, so I think it really is, we just go through the process again, right? If they're unable to find the member, we need to understand what service is being provided. So does that service require a prior authorization or not? So it really just, that's step one. And if it is prior authorization, that should happen automatically, right? So if they're unable to see that member, I believe the step that we provided is, create a ticket with our support team so that we can start reviewing, right? We may have received the information and we just need to make a few updates to the authorization so it imports successfully. But that should be really an automated process. So I think if the provider validates that the service is, does require prior auth and they can't see that member, then they need to enter a ticket with our support team. But if that service does not require prior authorization and they can't see the member, then they need to create that member and walk through that auto placement by service code process.
Perfect. And then there's a question asking if there's a phone number for support or if for anyone that isn't able to create a ticket.
Yeah, there is. Let me, I do not know it off top. That's terrible for me to say. I do not know it off the top of my head and I do apologize, but I can absolutely include that in our presentation on one of the last slides. Just add it there and be able to hand that out.
Perfect. And then another question about if there's any changes on when there's an MCO as the payer versus the state being a payer. Everything is the same workflow, is that correct?
Yeah, absolutely.
All right, let me just keep going through. I don't want to get too off track, but would you be able to speak of how should a provider proceed for a service that requires a prior authorization, but there's just a delay from the county sending over the authorization? How would you be able to walk us through how to create a temp authorization by chance?
Yeah, I can.
I know, I'm sorry, I don't.
No, I wish I just had something staged so it would have been more helpful, just so that I could actually like show you. So there's a few things that you can do, right? If you're utilizing EVV, what you can do is you can try to, if there's no authorization, you could try to do an unscheduled visit. You could also call in and what would happen if you don't have a scheduled visit and it's unable to locate the member, at least those you can, those calls or the call in and call out, right, for the services that you're providing will default and kind of end up on what we'll call call maintenance or call dashboard. Okay, and then once that member does import, say it's just a little bit delayed a few days, they can then go back and link those previous calls to the member or that scheduled visit after the auth imports. So it's almost like try to go through the process as normal, although you may not have, right, like the member. You still want to go through that and try to record, right, those electronic visit verification, right, the clocking in and clocking out, and then later link those back to the services that you schedule in the, I guess, in the future, kind of.
Perfect, thank you.
Yeah, no worries.
I am seeing a couple very specific questions from folks. about their specific portals or being referred back to payers and having very specific questions. For those of you that have asked those more specific questions, I would encourage you to please go in and create a ticket with HHA Exchange and see if we can get those resolved that way versus getting into some very specific questions in this Q&A. Other than that, I'm not, Amanda or Missy, feel free to jump in if I missed one, but I'm not seeing anything in our Q&A panel here that we haven't addressed. So I'll give it maybe another minute or so for questions for HHA Exchange here on both of these processes, the auto placement or the missing members and support tickets, and then we'll move on.
Looks like you got it all, Sarah.
All right, we're just running into a little technical issue with Amanda's headphones here. Give us 1 second, I apologize.
Hear me now?
Very soft.
Yeah, What's that? Can you hear me now?
Yeah, it's a little better. Yep.
Okay, I'll just talk loud because fortunately my headphones died. But
Can you put the deck back up, please?
Yep, I'm pulling it right back up right now.
Thank you.
Yep. Can you see it?
Yep, got it.
All right. Thanks HHAX for coming and presenting. We have a few updates before we finish up for the day. The current state of EVV in Minnesota is we are in a soft launch. All services have now been implemented and we are in post-implementation. We do still understand that it's going to take time for providers and members and caregivers to make EVV routine with their organizations and their daily services. This is why we have decided to do a soft launch before we start enforcing compliance. We continually monitor the use of the system and provide technical support as needed. So in order to get going, if you have not done so already, you will need to complete the provider enrollment form, regardless if you are choosing to use HHAX or to use a third-party system. This will begin the process of you connecting and getting your portal set up. The links to the enrollment forms are in the presentation. You can also find them on our website and HHAX's website. If you are working with an MCO, you only need to complete the enrollment form one time. Or multiple MCOs, my apologies, if you're working with multiple MCOs. We have the DSD contact form for you to contact the EVV team directly. HHAX has their client support portal. If you need information about your authorizations and billing, you can visit the MHCP provider resource. And MCO providers working with MCOs should contact their MCOs for direction on using EVV. Non-providers, when contacting the EVV team using the DSD contact form, should use the public option under identify your role instead of other on this form. We have 3 more engagement sessions scheduled this year. One will be in June, then September, and December. We continue to use information and feedback we receive to drive these meetings and these sessions, and hope that you guys find them useful and you're getting some answers and clarification to some things. You can also find additional resources about EVV that you can read either through this presentation, or you can find it on our webpage. Thank you so much for being here today. If you have any further questions, please enter them into the Q&A, but that concludes our presentation for today.
All right, there are a couple in the Q&A, a couple questions in the Q&A. I'll go through a few out loud here that I haven't already answered in writing. First, about living caregivers, asking if, since living caregivers only need to enter once per day, but not in real time, can they just continue to use paper time cards? So I again want to make a statement saying that EVV and time cards are not the same thing. So your agencies may need to continue time cards and paper if you use that for payroll purposes. However, paper cannot replace EVV. So even though for living caregivers, they only have to interact with the system once per day, it still has to be an interaction using EVV tools. So whether that's using the mobile app to quickly log in, clock out, using a telephony IVR line to do a quick phone clock in, phone clock out, it doesn't particularly matter what that EVV tool is or when that's done as part of the workday, but it does need to be used. That EVV tool needs to be used for that clock in. If you want to use paper time cards for your payroll purposes, by all means, please feel free and go ahead to do that. Again, there's a couple of questions I've seen about claims and using different vendors for claims. And then just a reminder that once again, right now at this time, claims are not included with EVV right now. So your claims are separate. You'll continue to do whatever your existing processes are for claims, and that'll be separate from your EVV visit data. Let's see, and I'm only seeing a couple more, maybe one more question here on compliance and when that's going to begin. You know, as we have stated previously, that is something that we are working on and kind of developing internally, and when we have a better idea on timelines, we will communicate that out. But as we have previously said, you know, we're aiming for 2024 to be the year of starting compliance. So look for it to start coming and getting more information later this year. And I'm sorry, I fell behind on questions, so give me a second. I got to read ahead here. Oh, great question about community visits. So using any individuals that you're supporting start their visits out in the community. And so regardless of vendor that you're using, you can, the HHA Exchange system has that community checkbox that can identify those visits that start or end in the community. And third-party systems, again, each system is going to be a little bit different, but you do have the ability, if your third-party vendor can send data that way, to use a community setting on those visits. So you would want to check a community checkbox, especially if you're using HHA Exchange. It's going to just help you not have to deal with a visit hitting the call dashboard or getting geofence errors and that sort of thing when we very obviously know that if someone's out in the community, they're not at their home. So for everyone that has the ability to use that community checkbox when they are doing community visits, probably save yourself a lot of headache by going ahead and choosing to use that community checkbox. I'm seeing a question about the GPS being inaccurate and community versus the home checkbox when the GPS is inaccurate. In an ideal situation, you would want to resolve that location error. You can, and I don't want to speak out of turn with HHA Exchange here, but there is a way to do it, resolving when it hits your call dashboard. There's a way to manually associate the location of the home back to the visit location when you do get a GPS error for a geofence error.
Yeah, that's correct, Sarah.
Thanks for stepping in there, Kyle.
I didn't know if you wanted me to or not. I was because you nailed it. You got it absolutely right. Within the call dashboard or call maintenance, there's a way to, when you look into the call, right? Because it'll say like geofence out of range, or that you're not where you're saying you are intended to be. When you go to the call dashboard, there's a way to update or adjust, right, like the visit location of the services that were being provided. I do know, and just because we have heard this in the past, I know that sometimes apartment buildings, can cause issues if there's like multiple in one, right, with the connection with your cell carrier, right? Like sometimes the signal might not be as strong, so it's picking you up somewhere else. If you ever do have that, you can always capture a screenshot of that, like when it's happening. Open a ticket with our support team just for us to look into a little bit more. It's always good to have them look into it and do some technical review. And then while that's happening, right, you can make adjustments, just as Sarah had stated, in the call dashboard and update it so that your location is accurate.
Thanks for clarifying, Kyle. I appreciate it.
No worries. You didn't need me to.
I see another good question in here about PCA drive time and how that might impact EVV. And so with EVV and PCA services, one thing that we want to make sure, anytime that the PCA is working, they should be clocking in using EVV. So that drive time should already be accounted for as part of that EVV visit. If they're providing a billable PCA service, they should be clocked into EVV. EVV will not in any way be able to track any kind of mileage or anything like that. Like that's not how location works with EVV. Just as a reminder though, but with that drive time being payable, if a PCA is clocked in to providing a billable PCA code, then they should be clocking in using EVV.
Yeah, Sarah, just to add to that, because that does come up pretty often. We do not track. That's not a word that we like to use, right? We only capture your location during clock in and clock out, right? Those events, that is when your location is verified or captured. We will not track, right, the route that you take or anything throughout that visit. We are only capturing, right, the geographic location when you clock in and or out.
Thanks for clarifying, Kyle. All right, it looks like there's some clarifying going on about the location in apartment buildings, and I just want to call out that it does look like if you take out the apartment number for some of those locations that are getting some rejection issues, it goes through. So for anyone that may have missed that, that might be a hot tip for you. I see a question that says, how is DHS getting data from HHA Exchange? Caregivers clock in and out and we resolve issues, but that's it. Are we supposed to send a report? Is it automatically sent to DHS for review? That's a really good question. I'm going to answer on the assumption that you're using HHA Exchange as your EVV system, and in which case there isn't anything further that you need to do. The system is configured to capture and send all of that data in real time, and HHA manages it all in real time as caregivers clock in, clock out, changes and updates are made, etc. Things that don't happen in real time are like authorizations and member profiles coming over. That's typically a nightly process. But now if you're using a third-party system, that would be on your vendor to some way set up a way of sending that data that you're capturing in your system to HHA Exchange. Best practice is to send that in real time, but it can be sent up in batches. And then I think we'll put a final call out here for questions in the next minute or so, and we'll just wrap up. Last question that I currently see about webinar information being sent out or posted somewhere. So if it's not already there in the, I think it's called the Training Archive, there's a link to the slides from DHS. We'll have to get the HHA Exchange slides posted or sent out at a later date, but we will get those either posted or sent out as soon as we can. And then in the slides that Amanda had up on screen earlier, it does have all of the future dates of our sessions. I do believe it's also within the training memo e-list that went out a couple weeks ago as well, that has those future dates listed in it as well. But general kind of schedule of things, it's the third Monday of the last month of every quarter is when we do these sessions. All right, and then another last question I'm seeing here is discussion. Is there any discussion by the state in eliminating the requirements for time and activity documentation since the EVV system's capturing 6 data points already and confirming location? So great question. Again, want to stress that the 6 data points that are required for EVV don't always meet all of every service's documentation or licensing or statutory requirements. So those things you do have to double check, make sure that you are meeting all of your documentation requirements. But using the HHA Exchange EVV system, we do have it configured for providers. If you wanted to utilize the EVV system for PCA time and activity documentation, you can capture all of those dependencies and care tasks within HHA Exchange. I think they're called like care duties. They come out as part of the clockout screen.
Yeah.
Go ahead, Kyle.
Absolutely, sir. Yeah, no, sorry. I was just going to jump in because it's like the specifics. But yeah, plan of care. I think we also have like duties performed. You may see them also listed as like other duties, just depending on like what you've added or maybe have not added within the system. So yeah, those can all be captured per visit. Actually, if you're using the mobile app, it's typically the easiest. After you clock in, you can capture them, I believe, live while doing so, or I believe you can also add them after that service has been concluded or you've clocked out. You can still add the duties that have been performed into the visit for each member.
Perfect, thank you. And then I do want to add to that one thing that is a little bit funky. If you are choosing to use HHA Exchange for electronically documenting that time and activity documentation, is capturing the days, excuse me, that folks are out of the community, like in a hospital or other facility type setting. You kind of have to use a little bit of a workaround right now. You would have to make sure that a missed visit is logged for that person when they're out of the community. Even if scheduling wasn't used, you'd still would want to log in as a missed visit. And then you would just select there's a drop down, a list of reasons, and I believe one of them is like a facility or a hospitalization. You would select that to document that day out of the community. No, you cannot use. There's a question about using EVV with private pay. Right now, no, there's no requirement to use EVV with private pay, and there wouldn't be any way to get any of that data into the system. It's not coming through DHS or MCO funding.
Thanks, Sarah, for your answering questions live, and Kyle for your support too. We're coming up on about 2 minutes, little over 2 minutes left here, so I think we can begin to wrap up unless there are other questions. If you have questions that come up after this session, please reach out to the EVV team through the DSD contact form or HHAX using their client support portal. We appreciate you all being here today. Thank you, everyone. Again, we will collect the questions that we were not able to answer during this session and post at a later time. Thank you again for joining. That concludes our session for today.